It would be a lie for me to say that I wasn't pissed about what I hear happening in our healthcare system, about people waiting 25 hours in an emergency, being told that they can't be seen by someone in a somewhat emergency for 4 months, being told that psychiatry is a 3-year wait, being sent to different emergencies because they're closed or they're at capacity. It is extremely angering and frustrating, but I want this to also be a call to action, because if we can't see right now where the gaps are and where we're struggling, then we can't rise to create the changes that we need to make, because we got to make some major changes here. We all need to know that we have a place that we can turn when we need help, when we need support, whether it's physical care, mental care, emotional care, spiritual care even. We need to know that there are places that we can turn. And right now, with our system the way that it is not a place that people feel safe to turn. And what that creates for people is a lot of uncertainty, a lot of fear and terror, actually. Terror and fear around, what am I going to do if my family needs help? Or heaven forbid something does happen and your family is in crisis and you need support and help and you don't know or you don't feel safe to turn anywhere. So what does this mean for us? This is the question we need to sit with, is what does this mean for us? If our system is so broken and so dismantled that it can't support us anymore, what are we going to do about it? Because we can't just wait for some other powers that be to swoop in and save the day and create the changes that they've been promising to us for years and have never made, or have only made very, very little progress on. It really lands on us as individual healthcare providers, nurses, doctors, other healthcare workers who are witnessing and seeing what is happening. It's time. We have to do something different. So how are we going to rise to this challenge and do it differently? What does that mean for us? Let's explore it. Let's talk about it, because it's going to mean something different for all of us. In my own way, my coaching, my business is my way of rising to fill the need, to see the gap in our services and fill that gap. And so if you're working, or you're even not working, and you're seeing the gap, maybe it's a call to action for you in some way to try to fill that gap. Or is there something that you need to do? Something that you're being asked to do in your life to be a part of creating what is on the horizon for us? The new world, or the new system, or the new paradigm, if you will, of what healthcare needs to look like, so that we truly are supported, we truly are taken care of in a holistic way. What is your call to action? Let's talk about it. It's not an easy answer by any stretch. This is extremely complex and extremely layered, with all of the different pieces of how this affects us on an individual level, on a cultural level, on a societal level, on a global level. But we can't create changes until we start talking about it, until we're just honest about it and face how angry we are about what is happening and about how it's affecting us and affecting our patients and affecting our families. And then looking at it from a lens of like, can I use this anger as fuel to guide me to what is my next step? What do I need to do differently so I can be a part of the change, a part of what we need to see happen? Because it's devastating what's going on right now. It's devastating to us all. It's not just devastating to the public. It's devastating to the people that are there, because they're frustrated too. The workers are frustrated. They want to be doing better. They didn't get into it for it to be like this. Healthcare workers, they got into that profession because they want to help people. And the constraints of what is going on right now is holding them back from that. And that is creating a ton of distress. And again, I really feel like this is an opportunity for us to really take a look. How do I want to rise into this? What's here for me? Why am I in this space right now at this time? let's talk about it.